Hi, welcome back to Animal Wellness Podcast. So I've got a special friend here. She is one of our vet nurses, actually a VacciCheck university qualified from University of Queensland. And she is Ellie, or Eltys, and has a couple of languages besides English in her background because she grew up in Hong Kong. So her native language is Cantonese. And she's now going to explain to you in Cantonese about the antibody Titre test that we use, that we have imported from Israel, called the VacciCheck from Biogal, and how that works for distemper, hepatitis, and parvovirus antibody levels. There you go. Ellie, take it away.
Okay, so 所以咧，我哋每年都會正常幫唔同動物去做疫苗嘅。咁狗仔嘅疫苗咧係有兩種，一種係 C3， 另一種係 C5。咁 C3 咧，我哋通常就係狗仔細個由6個禮拜開始就可以接種嘅疫苗，然後就1個月之後再接種一次 C5。而其實疫苗嘅話咧係唔需要每一年都要做嘅，我哋只需要係每年都去做一個所謂嘅Titre test。我哋需要做嘅咧就係喺佢哋嘅血管度抽取1毫升嘅血，然後去 run 呢個Titre test 咧，咁我哋就知道佢大約係身體裏面夠唔夠抗體。如果足夠嘅話咧，其實我哋係唔需要去過度接種個疫苗嘅，因為其實疫苗係有機會影響到我哋嘅腎臟同埋肝臟嘅function 嘅。咁正如啱啱 Dr Elaine 所講咧，呢個 Titre test 咧其實係可以喺呢個 Biogal Biogal 度可以訂購嘅。咁其實呢個 kit 咧就唔係話好貴嘅啫，正常係講咧就我哋收取嘅費用就大約係89澳紙，但係佢可以幫到你嘅咧就係你唔需要真係過度去接種個疫苗，令到你狗仔嘅腎臟或者肝臟去提早衰竭。雖然唔係話100% 係會有機會發生，但係可以唔做就當然唔做啦嚇。
Thank you. What you said, that sounded good. I didn't understand a word, but it sounded really good.
You only understand C3, C5, and Titre test.
And Biogal.
Yeah.
And I guess what I wanted to explain was why we would bother doing an antibody Titre test. Did you?
Yeah, I did explain
You did explain that. That's great. And as a holistic practice, we do tend to see the vaccine damaged. Now, to be fair, it's probably not 100% of people or pets that have any vaccine damage. Most animals and people will probably go through without having any problems. However, if you have a look at Asia syndrome, that's ASIA, which is about autoimmune diseases spurred on and caused by mostly excipients, but possibly even the not just the adjuvants of vaccines, but the things that are the antigens in the vaccines. This is from a prominent professor in Israel called Professor Schoenfeld. If you go to PubMed, that's PubMed, PubMed, and then type in Asia syndrome and Schoenfeld, you'll see some of the scientific research that proves that vaccines can in fact cause an autoimmune disease, and there are other problems that they can cause, such as an anemia. That's an autoimmune disease as well, and fibromyalgia, myositis. So some vaccines that have a lot of adjuvants can actually cause an irritation in the muscle. So we try to avoid these things, and certainly we have seen dogs that have had a vaccine as, say, a 6-year-old and then start seizuring within 12 hours of having the vaccine. And in children, this also does happen. So this is a side effect of vaccines. You can have some of the ingredients cross the blood-brain barrier and cause some harm. Now, vaccines are a very important thing to have, and we don't want to put people off and say you should never have a vaccine, because there are some illnesses that can kill you. and a vaccine is the lesser evil in those cases. But what we know from science is that if you use a modified live vaccine, you should get antibody levels that will probably protect you for a very, very long time, which nullifies the need for an annual vaccine for most dogs. So just so that you're aware that that is the case, and what we're trying to do is best practice medicine. Thanks for listening.